Tell us a bit about yourself and why you want to come to work with our hospital.
Thank you for this opportunity. My journey in nursing began with a profound desire to contribute directly to patient well-being, and this aspiration led me to specialize in surgical nursing. For the past 7 years, I have been working as a registered nurse in the surgical department at City General Hospital, where I have gained comprehensive experience in preoperative, intraoperative, and postoperative care across a diverse range of surgical specialties, including general surgery and neurosurgery. My responsibilities have encompassed patient assessment, medication administration, wound management, and critical patient monitoring in the perioperative setting. I am particularly adept at anticipating the needs of the surgical team and maintaining a calm and efficient operating room environment, especially during complex procedures. Beyond my technical skills, I am deeply committed to providing holistic and patient-centered care, recognizing the unique anxieties and vulnerabilities patients experience throughout the surgical process. It's this commitment that motivates me to seek a position at University Medical Center. I have been consistently impressed by University Medical Center's reputation as a leader in robotic-assisted surgery and enhanced recovery protocols and its clear dedication to providing compassionate, evidence-based care to all patients within a technologically advanced setting. I am particularly drawn to the hospital's pioneering work in minimally invasive cardiac surgery and its strong emphasis on interprofessional collaboration within the surgical teams, and I believe my skills and experience align perfectly with your hospital's commitment to excellence. I am eager to contribute to a team that is so clearly dedicated to advancing surgical care and improving patient outcomes, and I am confident that working at University Medical Center would provide me with the ideal environment to further develop my skills and make a meaningful contribution.
What key attributes, characteristics, do you think make a good nurse?
In my view, several key attributes are essential for a nurse to excel and provide truly exceptional patient care. Firstly, a strong foundation of clinical competence is paramount. This encompasses not only possessing the necessary technical skills and knowledge to perform nursing procedures safely and effectively but also demonstrating sound clinical judgment in assessing patients' conditions and making informed decisions. Beyond technical proficiency, compassionate communication stands out as a critical attribute. A good nurse can effectively communicate with patients and their families, listening attentively to their concerns, explaining complex medical information in an understandable way, and offering reassurance and emotional support during often vulnerable times. This ability to build rapport and trust is invaluable. Furthermore, empathy and compassion are at the heart of nursing. A truly good nurse can connect with patients on a human level, understanding their experiences, showing genuine care, and advocating for their needs with sensitivity. This emotional intelligence allows nurses to provide holistic care that goes beyond just the physical aspects of illness. Professionalism and responsibility are also indispensable. This includes maintaining ethical standards, adhering to confidentiality, being accountable for one's actions, and demonstrating a commitment to continuous professional development. Nurses operate within a complex and demanding environment, and these qualities ensure they are reliable and trustworthy members of the healthcare team. Finally, adaptability and resilience are increasingly important in today's healthcare landscape. Nurses must be able to manage multiple priorities, respond calmly and efficiently to unexpected situations, and cope with the emotional and physical demands of the profession. The ability to learn quickly, adapt to changing circumstances, and maintain composure under pressure are vital for navigating the challenges of modern nursing and providing consistently high-quality care. In essence, a combination of clinical skill, compassionate communication, empathy, professionalism, and adaptability defines a truly excellent nurse.
What skills do you have to contribute to this post?
I believe I possess a range of skills that would allow me to make a valuable contribution to this post. Firstly, my clinical skills, honed over 6 years working as a registered nurse, are directly transferable and relevant. I have extensive experience in complex wound management and post-operative patient monitoring, and am proficient in intravenous cannulation, wound VAC therapy, and utilizing electronic health record systems like Epic. I am confident in my ability to quickly become competent and contribute effectively to the daily clinical demands of this role. Beyond technical expertise, I bring strong communication and interpersonal skills. I have consistently demonstrated the ability to build rapport with patients from diverse backgrounds, effectively communicate complex medical information in an understandable manner, and collaborate seamlessly with interdisciplinary teams, particularly in the surgical setting. I understand that clear and compassionate communication is vital for patient safety and well-being, and I am dedicated to fostering a positive and collaborative working environment within the surgical unit. Furthermore, my experience in a fast-paced, high-volume surgical unit managing a caseload that frequently included critical post-operative patients has instilled in me excellent organizational and prioritization skills. I am adept at managing multiple tasks simultaneously, responding effectively under pressure during surgical emergencies, and maintaining meticulous attention to detail, which I believe are crucial for ensuring efficient and safe patient care in a demanding surgical healthcare setting. Finally, I am a proactive and solutions-oriented individual. I am not only comfortable following established surgical protocols but also possess the initiative to identify areas for improvement within the unit's workflow and contribute to problem-solving within the surgical team. I am eager to learn new surgical techniques, adapt to evolving best practices, and consistently strive to enhance the quality of care I provide to surgical patients. In summary, I believe my blend of clinical proficiency, strong communication abilities, organizational skills, and proactive approach would allow me to integrate quickly into your surgical team and make a meaningful contribution to this post and to the patients under our care.
How has your training and experience helped to develop these?
My nursing training and professional experiences have been instrumental in developing the skills I previously outlined. Regarding clinical skills, my foundational nursing degree at the University of Toronto provided the essential theoretical knowledge and initial practical training through clinical placements in various healthcare settings. These placements, particularly in demanding surgical and medical units at Toronto General Hospital, allowed me to practice core nursing procedures under supervision, such as medication administration, wound care, and patient assessments, gradually building competence and confidence. Furthermore, my 5 years working at Mount Sinai Hospital provided continuous on-the-job training, exposing me to a wide range of clinical scenarios and complex patient cases, which significantly refined my clinical judgment and technical proficiency. For example, regularly participating in advanced cardiac life support courses and specialized workshops on complex wound management and negative pressure wound therapy demonstrably enhanced my skills in these critical areas. In terms of communication and interpersonal skills, my training at the University of Toronto emphasized therapeutic communication techniques and patient-centered care. Practicing communication skills in simulated scenarios during my degree and then applying these in real-world patient interactions at Mount Sinai was crucial. Working within multidisciplinary teams in my previous role further developed my ability to communicate effectively with colleagues, physicians, and allied health professionals, learning to convey information concisely and respectfully in a high-pressure environment. Moreover, consistently engaging with patients and families from diverse backgrounds at Mount Sinai Hospital, a very diverse patient population, strengthened my empathy and ability to tailor my communication approach to individual needs and preferences, building trust and rapport even in challenging situations. My organizational and prioritization skills were honed by the demanding nature of the nursing practice itself. Managing a heavy patient workload in Mount Sinai Hospital's busy general surgery unit, where efficient time management and task delegation were paramount, forced me to develop systematic approaches to prioritizing care and organizing my workflow. My experience in managing emergency post-operative admissions directly from the operating room and coordinating complex discharge plans for patients requiring extensive home healthcare arrangements taught me to remain calm under pressure, anticipate potential issues, and proactively manage my time to ensure patient safety and optimal care delivery. The fast-paced environment inherently demanded strong organizational skills, which I actively cultivated and refined. Finally, my proactive and solutions-oriented approach has been fostered through both formal training and experiential learning. My nursing curriculum at the University of Toronto encouraged critical thinking and problem-solving, and I actively sought opportunities to engage in quality improvement initiatives in my previous role. For instance, I was involved in a unit-based project to improve medication reconciliation processes upon patient admission, which significantly reduced medication errors, and a separate initiative to streamline patient handover processes between shifts using a standardized SBR communication tool, which required me to identify areas for improvement, propose solutions, and collaborate with colleagues to implement changes. This experience, along with encountering and resolving numerous unexpected clinical challenges on a daily basis, has cultivated my proactive mindset and strengthened my ability to contribute constructively to problem-solving and continuous improvement within a healthcare team.
What support do you think you will need in your first 3 to 6 months?
In my first 3 to 6 months, I anticipate needing primarily orientation and support to integrate quickly into your specific surgical environment. While I bring a solid foundation of surgical nursing skills and experience, every hospital and surgical unit operates with its own unique workflows, protocols, and team dynamics. Therefore, initially, a structured orientation to your hospital's electronic health record system, surgical protocols, and specific unit routines would be invaluable. This would allow me to efficiently navigate the practical aspects of my daily tasks and ensure I am fully aligned with your established best practices for patient care and safety. Beyond the formal orientation, access to a designated mentor or experienced surgical nurse within the team for the first few months would be incredibly beneficial. This would provide a go-to person for clarifying any questions that arise in real time, especially during the initial period of acclimation to new procedures or equipment specific to this hospital. It would also facilitate a smoother integration into the existing team and allow me to learn from the expertise of experienced colleagues in this particular surgical setting. Furthermore, I believe access to ongoing learning resources and opportunities would be supportive in the long term. Staying current with the latest advancements in surgical nursing is a priority for me, so having access to internal training programs, relevant online resources, or opportunities to attend hospital-sponsored workshops related to surgical specialties or advanced techniques would be highly appreciated. This commitment to continued professional development would not only benefit my individual practice but also allow me to contribute to the team's overall knowledge base and the quality of care we provide. In essence, the support I envision needing is focused on efficient onboarding and continuous professional growth within your specific environment. I am a proactive learner and eager to become a fully contributing and effective member of your surgical team as quickly as possible, and I believe these support mechanisms would facilitate that successful integration.
Where do you see yourself in 5 years?
Looking ahead 5 years, I envision myself as a highly skilled and experienced surgical nurse, deeply embedded within your team here at University Medical Center and making a significant contribution to the surgical department. My primary goal is to become a recognized clinical expert in robotic-assisted colorectal surgical procedures and the associated perioperative management. I aim to achieve this through a combination of continued practical experience within your renowned surgical department, actively participating in professional development opportunities offered by University Medical Center's Center for Surgical Innovation, and potentially pursuing certifications relevant to my chosen specialization. For example, I am very interested in becoming a certified robotic surgical nurse through the Competency and Credentialing Institute, CCI, and pursuing advanced training in robotic surgical assisting offered here at University Medical Center, and I see University Medical Center, with its strong focus on robotic surgery and advanced surgical technologies, as the ideal environment to achieve this. Furthermore, I aspire to take on increased leadership responsibilities within the surgical unit, perhaps in a role such as a surgical team leader or preceptor for new graduate nurses joining the OR. This could involve mentoring new nurses in robotic techniques, participating in unit-based quality improvement initiatives focused on enhancing efficiency in the robotic surgery suite, or potentially taking on a charge nurse or preceptor role to guide and support team development. I believe in fostering a collaborative and supportive team environment, which is especially crucial in the demanding OR setting, and I am eager to contribute to the professional growth of my colleagues and the overall efficiency and effectiveness of our surgical services, particularly within the robotic surgery program. Ultimately, in 5 years, I see myself not just as an individual nurse progressing in my career, but as a valuable and integral member of the University Medical Center surgical team, consistently providing exceptional patient care in complex robotic procedures, actively contributing to a positive and thriving work environment within the OR, and continuously advancing my skills to meet the evolving needs of our patients and the cutting-edge surgical field. My commitment is not just to personal growth but to leveraging that growth to benefit University Medical Center and the patients we serve through its innovative surgical programs, and I believe this role provides the perfect trajectory to achieve these long-term aspirations within a leading institution like yours.
What are the essentials of infection prevention?
The essentials of infection prevention are multifaceted and absolutely critical in any healthcare setting, especially within surgery, where the risk of infection can have serious consequences. At its core, effective infection prevention hinges on breaking the chain of infection at every possible point. The most fundamental element is meticulous hand hygiene. This means consistent and correct hand washing with soap and water, or the use of alcohol-based hand rub, before and after every patient contact, procedure, and whenever hands become potentially contaminated. This seemingly simple act is the single most effective way to prevent the transmission of pathogens. Building upon hand hygiene are standard precautions. These are a set of infection control practices used for all patients, regardless of their known or suspected infection status. Standard precautions include the appropriate use of personal protective equipment, PPE, such as gloves, gowns, masks, and eye protection, depending on the anticipated exposure. Safe injection practices and proper respiratory hygiene, like covering coughs and sneezes, are also key components of standard precautions. In addition to standard precautions, transmission-based precautions are essential. These are implemented based on the suspected or confirmed mode of transmission of specific pathogens. They include contact precautions for infections spread by direct or indirect contact, droplet precautions for infections spread via respiratory droplets, and airborne precautions for infections spread through the air. Understanding and correctly applying these precautions is vital to containing the spread of specific infections within the surgical environment. Beyond direct patient care practices, environmental hygiene plays a crucial role. Regular cleaning and disinfection of frequently touched surfaces, patient rooms, and the operating room environment itself are essential to minimize the presence of pathogens. Adherence to strict cleaning protocols and the appropriate use of disinfectants are key components of this. Another critical aspect, especially in surgery, is device and equipment sterilization and disinfection. Surgical instruments and medical devices must be rigorously sterilized or appropriately disinfected according to established guidelines to eliminate microorganisms and prevent surgical site infections. Proper processing, storage, and handling of these items are paramount. Furthermore, antimicrobial stewardship is increasingly recognized as an essential element of infection prevention. This focuses on using antimicrobial medications judiciously and only when necessary to prevent the development of antimicrobial resistance. Appropriate antibiotic prophylaxis in surgery, guided by evidence-based guidelines, is a critical aspect of this. Surveillance and monitoring for infections are also vital to identify trends, detect outbreaks early, and evaluate the effectiveness of infection prevention strategies. Regular audits of infection control practices and data collection on infection rates allow for continuous improvement and targeted interventions. Finally, education and training are essential for all healthcare staff, patients, and visitors. Ensuring that everyone understands infection prevention principles and their role in preventing transmission and receives ongoing education reinforces a culture of safety and promotes consistent adherence to best practices. In summary, effective infection prevention in surgery relies on a comprehensive and consistent approach encompassing meticulous hand hygiene, adherence to standard and transmission-based precautions, robust environmental hygiene, proper equipment processing, antimicrobial stewardship, surveillance, and ongoing education. These elements, working in concert, are the cornerstones of a safe surgical environment and are fundamental to protecting patients from healthcare-associated infections.
How would you support a new member of staff that you can see as struggling to cope but is too shy to ask questions?
If I noticed a new staff member appearing to struggle but seeming hesitant to ask for help, my first step would be to proactively approach them in a supportive and non-intimidating manner. I would start by observing their behavior carefully for consistent signs of difficulty, such as looking overwhelmed when charting on Epic, taking longer than expected to complete medication passes, or exhibiting signs of stress like repeatedly sighing, while being mindful that everyone adjusts differently. Instead of directly asking "Are you struggling?" which might feel confrontational, I would opt for a more casual and supportive opening. For example, if I saw a new nurse, say Sarah, looking hesitant near the medication cart, I might approach her during a quieter moment and say something like, "Hi Sarah, how are you finding things on the surgical unit? Is there anything I can help with or clarify as you get settled in?" This opens the door for them to share any concerns without feeling directly called out or pressured. If she still seemed hesitant, I would try to offer concrete, practical assistance rather than just a general offer of help. I might say, "I remember when I first started on this unit, the wound VAC dressing changes took me a little while to get the hang of. Would it be helpful if we quickly reviewed the hospital's protocol for wound VAC application together? Just to ensure we are both on the same page with how things are done here." Offering specific assistance related to a task normalizes the experience of needing help and makes it easier for her to accept support without feeling inadequate. Furthermore, I would emphasize that asking questions is not only acceptable but actively encouraged within our surgical team. I would want to reinforce our unit's culture of open communication. I could reassure her by saying something like, "Please know that everyone here on the surgical team is really supportive, and we all understand there's a learning curve when starting a new role, especially in the OR. There are no silly questions, and we'd much rather you ask for clarification on something like setting up the robotic surgical equipment than feel unsure or struggle in silence. We're all here to support each other, especially in high-pressure situations." Beyond immediate assistance, I would make a conscious effort to check in with her regularly, especially in the initial few weeks, perhaps during handover or during lunch breaks, just to see how she is progressing and to reiterate my open-door approach for any questions or concerns. This ongoing support and gentle encouragement can help build her confidence over time, demonstrating that help is readily available and that her well-being and success within our team are valued. Ultimately, my goal would be to create a safe and supportive environment where she feels comfortable enough to eventually voice her needs independently, knowing she is surrounded by a team willing to assist her in providing excellent surgical nursing care.
You are doing your drugs round when you realize you did a drug error. What do? What actions can be taken to prevent mistakes from happening?
Discovering a medication error during a drug round immediately triggers a very specific and crucial set of actions, with patient safety being the absolute priority. Firstly, my immediate action would be to stop the drug round completely and ensure the patient's immediate safety. This means assessing the patient for any immediate adverse effects from the medication error, such as allergic reactions, changes in vital signs, or any new symptoms. This assessment would be thorough and focused on the potential harms associated with the specific medication and error type. Secondly, I would immediately inform the appropriate senior staff member, typically the nurse in charge or the shift coordinator, and also the prescribing physician. Providing a clear and concise report of the error, including the drug name, dose, route, time, patient details, and the nature of the error, is essential for prompt medical review and further orders. Transparency and speed are critical at this stage to ensure timely interventions and mitigate any potential harm to the patient. Following these immediate patient safety steps and notifications, the next action is to adhere strictly to hospital policy regarding medication errors and incident reporting. This invariably involves completing a detailed incident report, documenting the error thoroughly and factually. This documentation includes not only the details of the error itself, but also the patient assessment findings, the interventions taken, and the notifications made to senior staff and the physician. Accurate and comprehensive documentation is vital for patient safety, legal purposes, and for organizational learning and improvement. Regarding actions to prevent future medication errors, a multifaceted approach is necessary. Reinforcing and consistently practicing the rights of medication administration is fundamental. This involves meticulously checking the right patient, right drug, right dose, right route, right time, and right documentation every single time, without fail. This practice, though seemingly basic, is the cornerstone of safe medication administration. Furthermore, implementing double-checking systems, particularly for high-risk medications, provides a critical safety net. Having a second qualified nurse independently verify the medication order, drug preparation, and dosage can significantly reduce the likelihood of errors, especially in busy or demanding situations. Minimizing distractions and interruptions during medication rounds is also crucial. Creating a dedicated and quiet environment for drug administration allows nurses to focus solely on this complex and critical task, reducing the potential for errors due to lapses in concentration. This may involve strategies like using "do not interrupt" vests or designated medication administration times. Improving communication and clarity in medication orders and prescriptions is another key preventative measure. Ensuring legible handwriting in paper-based systems, or clear and standardized electronic prescribing systems, minimizes misinterpretations of drug names, dosages, or routes. Furthermore, robust handover processes and clear communication during shift changes about medication orders are vital for continuity of safe medication management. Leveraging technology, where available, can also significantly enhance medication safety. This includes utilizing barcode scanning systems to verify medication against patient identity, automated dispensing cabinets to reduce manual handling errors, and clinical decision support systems within electronic health records to flag potential drug interactions or dosage concerns. Finally, fostering a culture of open reporting and learning from errors, rather than blame, is paramount. Encouraging staff to report errors without fear of reprisal allows for analysis of system weaknesses and the implementation of proactive strategies to prevent recurrence. Regular medication safety audits, root cause analysis of errors, and ongoing education and training for staff on medication safety best practices are all essential components of a comprehensive infection prevention strategy. In summary, a combination of individual vigilance, robust systems, clear communication, technological aids, and a blame-free learning environment are all crucial to minimizing medication errors and ensuring patient safety.
You are witnessing an angry patient shouting at another patient. What would you do?
Witnessing a patient becoming verbally aggressive towards another patient immediately requires a calm, measured, and patient-centered response. My first priority would be to ensure the immediate safety and well-being of both patients involved, as well as any other patients or visitors in the surgical waiting area. This means quickly but calmly approaching the situation to assess the immediate risk and prevent any potential physical escalation, especially in a potentially crowded waiting space. My initial intervention would be to verbally de-escalate the situation with a calm and empathetic tone. I would approach the angry patient, let's say Mr. Jones, in a non-confrontational manner, speaking clearly and softly, perhaps saying something like, "Mr. Jones, I can see you're upset. Let's talk over here for a moment, what's happening?" While gently gesturing to move slightly away from the other patient, Mrs. Davis. The goal here is to interrupt the immediate escalation, acknowledge his emotions without validating aggressive behavior, and shift his focus from Mrs. Davis to myself as a staff member. I would then actively listen to Mr. Jones to understand the underlying cause of his distress. Perhaps he's in severe pain and is frustrated with the wait time for medication, or he's confused about his discharge instructions. I would allow him to express himself, listening attentively without interruption initially, to try and identify the trigger for his anger. Showing empathy and understanding at this stage is crucial, even if I don't condone his behavior. For example, I might say, "Mr. Jones, I understand you're feeling frustrated with the waiting time, or it sounds like something about your medication schedule has really upset you." Simultaneously, while engaging with Mr. Jones, would also be attentive to Mrs. Davis, the patient who is being shouted at, ensuring her comfort and safety. I would discreetly check on her, perhaps offering her a chair in a quieter part of the waiting area or a glass of water, with a quiet word of reassurance like, "Mrs. Davis, are you all right? I'm here." To let her know she is not alone and that staff are present and responsive. If it seemed appropriate and safe to do so, I might gently guide Mrs. Davis to a slightly different area of the waiting room to create some physical separation and reduce immediate tension while still remaining present with Mr. Jones. Once I have a better understanding of the situation from Mr. Jones's perspective, I would then attempt to address the root cause of his agitation in a constructive manner. If his frustration is about pain, I would immediately assess his pain level and expedite pain relief if appropriate, or explain the process and estimated timeframe clearly. If it's confusion about discharge, I would offer to clarify his instructions and answer his questions. It's important to address the underlying issue while calmly and firmly setting boundaries regarding acceptable behavior, explaining that while his feelings are valid, shouting at other patients is not acceptable. For instance, I might say, "Mr. Jones, I understand you're upset about the wait for your pain medication, but it's not okay to shout at Mrs. Davis or other patients. Let's see if I can check on the status of your medication for you right now, and then we can talk more calmly about how you're feeling." If de-escalation strategies are not effective, or if the situation continues to escalate or becomes unsafe, I would immediately seek assistance from colleagues and potentially hospital security, following the Code Gray protocol for managing escalating patient behavior. Knowing when to call for help is crucial for patient and staff safety. I would discreetly signal to a nearby colleague or directly contact the charge nurse and hospital security to provide backup and support in case verbal de-escalation is insufficient. Following the immediate situation, it is essential to document the incident thoroughly and accurately in the electronic patient record and also complete a separate incident report. This documentation includes the trigger for Mr. Jones's agitation, the de-escalation interventions I used, the response of both patients, and the outcome of the situation. This documentation is important for both patient records, for communication with the healthcare team, and for potential review and learning to improve future patient management strategies on the surgical unit. Finally, in the aftermath, it would be important to check back with both Mr. Jones and Mrs. Davis later in the shift. To ensure Mrs. Davis is feeling safe and supported, perhaps offering a quiet space to decompress if needed, and to follow up with Mr. Jones, once he is calmer, to reflect on the incident, offer any necessary support, and potentially involve social work or patient advocacy if the underlying issues are more complex or require further intervention. This demonstrates a commitment to holistic patient care and to fostering a safe and respectful environment for everyone in our care on the surgical unit.